What is semen retention? According to a study, 58% of men between the ages of 20 and 29 reported ejaculating over 3 times a week. In comparison, the proportion of 3 ejaculations a week dropped to 32% among 40 to 49-year-olds. The frequency continued to decline among older individuals. Semen retention means avoiding ejaculating. However, it can be different from abstinence. Even if you try semen retention, you can still have an orgasm, you just won't ejaculate. Ejaculation releases semen from the penis, whereas orgasm is linked with sexual climax. It is when your feelings of relaxation and pleasure are in high gear. In other words, ejaculation is what happens in the pelvis, and orgasm is what occurs in the mind. To experience the semen retention effects, you would intentionally avoid ejaculating. How is it done? There are a couple of ways to achieve semen retention. You can have sex and stop before you ejaculate. You can abstain from intercourse completely or teach yourself to orgasm without having to ejaculate. All in all, it takes an ample amount of self-control. A masturbation aid device, such as personal lubricants and masturbators, combined with some behavioral techniques, can help. Like the pause and squeeze technique. Have your partner squeeze the end of the penis and keep the squeeze for a couple of seconds. Wait for a bit until the urge dissipates. This practice is not something new. On the contrary, it has deep roots in Taoist sexual practices. It exists in other cultures as well. But, under different names, such as sexual continence, Maithuna, Hindu Tantra, coitus reservatus, Latin, Sahaja, Hindu Yoga, and others. There aren't many semen retention books and studies that offer some insight into this practice. However, you shouldn't confuse semen retention with today's practices such as orgasm control and nofap. Orgasm control means delaying ejaculation and orgasm up to the hilt and then allowing both of them at the end of the intercourse. The nofap term means avoiding solo sex, masturbating and watching porn. But, people can have sex with a partner, ejaculate, and orgasm. Semen retention is also different from retrograde ejaculation. This condition occurs when the semen enters the bladder, rather than exiting through the penis. As a result, little to no semen comes out. Is it healthy to retain sperm? There isn't enough semen retention science to know for sure whether this practice can be beneficial in the long run. But, experts say it may have potential benefits. When men try to hold in their semen for an extended period of time, this practice could help them enhance their physical health, mental health, spiritual well-being. 2018 research indicates that shorter abstinence, less than 24h, substantially improved sperm motility. This semen retention timeline proved particularly beneficial for progressive velocity and motility. It might also amplify physical rejuvenation and increase testosterone levels and muscle mass. With that in mind, semen retention and testosterone are important to talk about. When the body doesn't expel the sperm, it absorbs it back into the system. This is where the idea of semen retention and testosterone boost came into the picture. Studies show that men had higher testosterone concentrations after 3 weeks of sexual abstinence. So, even if acute abstinence won't change the relationship between the nervous and endocrine systems for orgasms, it can create higher serum testosterone levels. But, semen retention effects could go beyond the physical benefits. It could boost motivation, self-confidence, focus, and energy. Those with better self-confidence may be less likely to struggle with anxiety. By focusing less on sex and various sexual practices, men can improve their concentration and pursue other achievements and goals. The semen retention power may have spiritual benefits as well. You can use the time to build a deeper and stronger emotional bond with your partner while you aren't focusing on the physical side of the relationship. It's about getting a stronger sense of purpose and overall harmony.